You know, when it comes to healthcare for ourselves or for our family, we all want the absolute best, right? We kind of hope for it, maybe we even expect it, but how do we actually guarantee it? How do you go from just hoping for good care to, building a system that delivers it every single time? All right, let's get into it.
And that's really the core question, isn't it? I mean, it's one thing to walk out of a hospital and feel like you got good care, but it's a completely different ballgame for a whole healthcare system to know, with actual data and certainty, that they're hitting their quality standards for every single patient, day in and day out.
Well, it turns out there is a process for that, a professional, really systematic way to answer that exact question. It's called evaluation, and you can think of it as the engine that drives all the improvements in nursing. It's the tool that takes that hope for good care and turns it into a certainty.
So, look, evaluation is way more than just a report card, pass or fail. It's a really dynamic tool. It lets us check, hey, did we actually hit our goals, like, say, cutting down on wait times? But it also shines a light on what's working great. Maybe one department has a rock-solid process for discharging patients. And, just as important, it points out the weak spots. That way, we can give specific feedback and ultimately make sure everyone is accountable for providing top-notch care.
And really, at the end of the day, it doesn't matter if we're talking about accountability or feedback or specific goals. It all comes down to this one simple, powerful idea. This is the whole point. It's about making a promise to every single person who needs care. Okay, so to actually make good on that promise, this whole evaluation thing can't be random. It can't just be based on someone's gut feeling. It has to follow a really clear set of rules, guiding principles that make sure the whole process is solid, fair, and, that it actually works.
So here's the formal definition, but let's break it down. The key words here are systematic, assessing, and judging. What that really means is this isn't some casual glance. It's a structured, intentional process. You're measuring how well you did against a goal you set beforehand. Basically, you're asking two simple questions. Did we accomplish what we wanted to? And how well did we actually do it?
And these are the principles that really make it all work. It's got to be objective and systematic, based on clear standards that everyone agrees on beforehand. Super important, it's a continuous thing, not a one-and-done test. The whole vibe is meant to be constructive, more about helping things grow, not just pointing out what's wrong. And it has to be comprehensive, looking at the whole picture, the structure, the process, and the final outcome. And you've got to involve the staff because they're the ones on the ground doing the work. It has to be valid, reliable, but also flexible enough for the real world.
So you can see, this whole thing is a real balancing act. On one side, you need it to be objective and systematic, organized, unbiased, like a well-oiled machine. But on the other side, it has to be flexible. It needs to bend without breaking, to adapt to all the different situations you find in a busy hospital or clinic. It's that mix of being strict and being smart that really makes it work.
All right, so we get the why behind all this, and we have the principles that guide it. But how do you actually do it? Well, there's not just one way. Think of it like a nurse manager has a whole toolkit with different tools for different jobs, all to get a full picture of how things are going.
So let's peek inside that toolkit. You've got things like direct observation, where a manager can actually see a nurse's skills in action. Or they could do a nursing audit, which is basically a deep dive into patient records. They're checking to see if everything that should be documented is documented, like was medication given on time, was wound care recorded properly. And if they find something, like maybe pain levels aren't always being checked after meds are given, that's not about blame. It's a golden opportunity. It's a clear signal for what kind of training is needed to fix the process.
And, sometimes the most powerful tool in the kit is just talking to people. Take a look at this quote from a patient. A checklist or a chart review is never going to tell you that someone felt heard and respected. This is the human side of care, and capturing that patient experience is absolutely essential for understanding true quality.
Now here's a look at two really important methods that happen inside the team. You've got peer review, which is where colleagues evaluate each other. The goal there is to keep everyone on the team accountable to the high standards of the nursing profession. Then you have self-evaluation. This is more personal. It's about looking in the mirror and figuring out where you can grow. You really need both for a strong, improving team.
So who is the person in charge of this whole toolkit, making sure all these principles are actually followed? That job, that huge responsibility, lands right on the shoulders of the nurse manager. They're the ones leading the charge for making things better all the time.
And this is basically their playbook. A manager's job isn't just one thing. It's a whole cycle. They start by setting the standards so everyone knows what's expected.
Then they use the right tools from the toolkit to see how things are going. After that comes the crucial part, giving constructive feedback. And they close the loop by taking all that information and using it to plan new training and drive real quality improvements. It's all about being proactive.
Okay, so we've gone through the purpose, the principles, the tools, the manager's role, but let's bring it all back to the most important person in the room, the patient. What's the end game here? What does this entire system actually produce?
Well, this chart pretty much says it all. Yeah, good evaluation helps with staff development, it makes decision-making sharper, and it keeps everyone accountable. But look at the biggest piece of that pie, 40%. The single greatest impact is on quality patient care. That's what this is all for.
So if there's one thing to take away from all this, it's that great patient care is not an accident. It doesn't just happen. It is the result of a very deliberate, professional, and ongoing system that's designed with one goal in mind: getting better, every day for every patient.
And that brings us to a final thought for you to chew on. We've been talking all about how measuring things is the key to improving them. So let me leave you with this question. If you were calling the shots and you could measure just one thing to improve healthcare today, what would it be? What would you focus on?